Hello and welcome to Baby Health. I'm Dr. Sandip Gupta, Senior Pediatrician and Childcare Expert. So thank you for liking our videos, and I've received a lot of admiration and comments on our previous videos, and there was a lot of questions regarding newborn babies' stools. Many parents asked me about the newborn baby's stool color, that why it is green and what happens, why the baby is having black color stool, and many parents asked me why the baby is not passing stool for 3 days, or questions like this were common. And so today I am making a video to answer all the queries like on the stool pattern of the newborn babies. So first of all, we'll start saying that when the baby is born, in the first 48 hours baby must pass stool. So within 48 hours baby pass stool, that is very important. So first 48 hours baby will pass a black color stool. So black color stool is nothing but what we call is, it is meconium stool. So meconium stool is nothing, the said material in the our baby's intestine, the dead cells will come and it will be black color. So usually first 1 to 3 days it can be a black color stool. Afterwards, as the baby starts breastfeeding, initially there will be some green color stool. So green color stool, many parents get anxious and stressed about it and keep calling me asking why the baby is passing green stool, whether it is any cough or any harmful material. So reason behind having green stools is our body secretes bile from the gallbladder and it comes into the intestine. So bile helps actually in digesting the fat in the body. So this bile, when it passes through the intestine curves, and it is deoxidized by some bacteria, and sometimes it is broken down by bacteria and it turns into yellow. So that's why its usual stool color is yellow to dark yellow. So over a period of time it changes from green to yellow. But what happens is, small babies, their intestine capacity is small and they take frequent feed. So the stool reaches the anus very fast and comes out very fast. So that bilious stool, it becomes green only. So the color remains green, it doesn't get enough time, or the transit time is less through the intestine, so it doesn't change the color. So that's why sometimes normally the baby's stool will be green. So that is not a cause for concern or worry. You can just be comfortable about it. It can be green for some time, that is not a worry, because baby have small intestine, so the stool passes fast, so it doesn't change color. So green color stool is normal, and sometimes child will have yellow color stool, light yellow, dark yellow, even brownish color stools can come, which are all normal and should not be worried about it. So this is a normal pattern. The color keeps on changing every day. Also it might change. Someday it will be green for 2 days and then yellow for another 3 days, and then again it can become green. So this is keeps on happening and the parents should not really worry about it. So about the color, only 2 situations they should worry is when they see any red color material in the stool. So if the breastfeeding baby is getting a red color in stool, that means there is some bleeding in the intestine pathway. Somewhere in the intestine child may have bleeding. So that is a very, very important cause of concern. Sometimes it happens because of the vitamin K deficiency, so which can be a very problematic situation. So we need to treat that. Okay. Apart from that, the another color of stool which should be concerned for parents is clay color stool or whitish stool. So whitish stool actually indicates lack of bile pigment in the stool, which means there can be jaundice. So it is an indicator of jaundice, and which again needs to be considered and treated by the doctor. So that's why if your baby is passing clay color stool or white color stool, then again it is a cause of worry. So these are the 2 color stools which you should be worried about. Now coming to another point is, sometimes mothers ask me as to whenever I feed my baby, the baby actually is passing stools. So is it a cause of concern? So I tell them this is absolutely normal. What happens is, when you feed your baby, baby's milk which baby is swallowing goes to the stomach, and in the stomach, baby's stomach is very small. So what happens is, it stretches the stomach and there is a reflex called gastrocolic reflex. So stomach is stretched, that time the anus and rectum contract, the part of which is just below the anal opening, that contracts and it passes the whatever liquid stool is there. So that is a normal phenomenon. So in smaller babies less than 6 months, it will happen very commonly that whenever you are putting the baby at breastfeeding, baby may pass immediately stool, or just after finishing the breastfeeding baby may pass stool, which is a very normal thing. It is called gastrocolic reflex. Now coming to another pattern in newborn babies is sometimes you may see that your baby is passing 4 to 6 times stools in a day. Especially in smaller babies less than 3 months, they may pass 6 times in a day, 7 times in a day. So parents get worried and keep asking me whether it is diarrhea. So actually it is not diarrhea, it is the same thing. Because the intestine length is small, the stool or the food material passes through the intestine very fast and it comes out very fast. So that is a normal phenomenon. You should not be worried about it unless it is very watery. If it is semi-solid consistency, you should not be worried about it at all. If it is totally watery and thin, then you may consider your consultation with your doctor. Apart from that, one more thing is, like I said, there are 4 to 6 times they may pass in a day. Similarly, they may not pass stool for 3 to 5 days again. So there can be a pattern where the baby may not pass stool for 3 to 5 days. That is also normal. So unless the baby is having very hard stools or stools which are called difficult to pass or baby has to stain, this is also normal in small babies. So less than 6 months, this is also normal to have 3 to 5 stools in 3 to 5 days interval. And sometimes, only rarely, you may have to give some rectal enema to make it pass, glycerin enema, which can be given, neotomic enema we give, so that to make the stool pass. So apart from these, there are certain problems which can happen when the baby does not pass stool for 7 days. So there are some pathological constipation causes which we should be worried about. So you should only worry about constipation in newborn babies when they don't pass stool for 7 days. So common causes of that is congenital hypothyroidism. So sometimes what happens is there is deficiency of thyroid hormone in baby, and that times baby can present with constipation like this. Apart from the thyroid deficiency, there is something called high calcium level. Hypercalcemia can cause constipation in newborn. And there is another disease which is a surgical disease, that is Hirschsprung disease. So Hirschsprung disease is a disease which is the disease of intestinal nerves. So what happens is the intestine contracts and propels the food material towards from up to down towards the anus, and in this disease what happens, there is a segment of the intestine which will not have that nerve, so circuit is not there, so that part is not contracting, so stool material will get stuck and it will get dilated and the child can have constipation and many problems because of that. So when we have that disease, mainly we suspect when the child has not passed stool in first 48 hours or the child is not passing stool for 7 to 10 days together. So that time we may suspect and investigate for these diseases. For that you need to consult your doctor. Thank you for listening to this video. I hope this information helps you. If you like this video, please share this information with all the parents who may need such information. I'll be coming up with more child health care content, and please subscribe to our YouTube channel. Thank you.